Terrific. It's so wonderful to see all of you. Welcome. And I hope everyone had a chance to get some lunch and settle on in. So welcome, everyone. My name is Lily Powell. I'm Associate Professor at the School of Nursing and also the Director of the Compassionate Care Initiative. If you are new to the Compassionate Care Initiative, I want you to know that we promote healthy work environments where all health workers can embody compassion in their work, with their patients, and with each other. The things that we do in the Compassionate Care Initiative include programming, education, and research that is focused on well-being, collaboration, and speaking up for healthy work environments. And I think we're going to hear a little bit about all of those topics today from our guest speaker. The CCI Learning Series is roughly a monthly series, and it features guest speakers like our guest today, Melnyk, as well as workshops and the short center rounds. So now it is my great pleasure to introduce you to Melnyk, who I had the pleasure of having breakfast with this morning. This woman has energy beyond measure. She doesn't need cups of coffee. She just has it. Okay. So Melnyk is Vice President for Health Promotion and Chief Wellness Officer at The Ohio State University, where she is also the Helene Fuld Health Trust Professor of Evidence-Based Practice in the College of Nursing and Professor of Pediatrics and Psychiatry in the College of Medicine. She is also founder of the Helene Fuld Health Trust National Institute for Evidence-Based Practice in Nursing and Healthcare. Dr. Melnyk is recognized globally for her expertise in evidence-based practice, child and adolescent mental health, clinician well-being, and intervention research, as well as her innovative approaches to population health and well-being. Bern is a frequent keynote speaker at national and international conferences and has presented hundreds of workshops on evidence-based practice, mental health, health and wellness throughout the nation and the globe. She is the editor of 7 books. She has authored more than 540 publications, and she has brought in over $36 million of sponsored funding from NIH, AHRQ, and foundations as a principal investigator. She's an elected fellow of the National Academy of Medicine, the American Academy of Nursing, that has recognized her 3 times as the Edge Runner, twice for her evidence-based COPE programs, and the National Academies of Practice and the American Association of Nurse Practitioners. Dr. Melnyk served a 4-year term on the United States Preventative Services Task Force, the National Advisory Council for the National Institute for Nursing Research, and the Behavioral Health Standing Committee of the National Quality Forum. Yes, and yes, there's more. She also served as vice chair of the National Forum for Heart Disease and Stroke Prevention, and recently received an honorary Doctor of Science degree from the State University of New York. Dr. Melnyk is editor-in-chief of the top-ranked journal, Worldviews on Evidence-Based Nursing. She was appointed to the National Academy of Medicine's Action Collaborative on Clinician Well-being and Resilience in 2017, on which she still continues to serve and is the founder and current president of the National Consortium for Building Healthy Academic Communities. She received her Bachelor of Science in Nursing from West Virginia University, her Master's of Science in Nursing and Pediatric Nurse Practitioner Education from the University of Pittsburgh, and her PhD in Clinical Research and Psychiatric Nurse Practitioner Education from the University of Rochester. Wow. Yeah. I do want to make a couple of special acknowledgments today. I want to also thank the Chief Nursing Officer, Kathy Baker, as well as the Dean of the School of Nursing, Marianne Bernholt, for co-sponsoring this session. Also note that we have a few Dean Emerita in our midst, Pam Cipriano and Dory Fontaine, who is our founder of the Compassionate Care Initiative. Continuing education credits are available for this program. There's a QR code on the table outside, and there'll also be a slide later with that information. Just so you know, Dr. Melnyk will be speaking for about an hour. If you need to slip out, please do, but we will have a 15-minute Q&A session after that. and then she will be leaving promptly to be whisked away to the gigantic Charlottesville airport. Okay, without further ado, Bernadette.
I am so excited to be here with all of you today. How many of you are excited about getting just a wee bit healthier? Okay, even if you're not excited, can you please act really excited for me? I just want to disclose, as Lily said, I'm editor of 7 books, and I do own 2 companies that have scaled my evidence-based programs to improve mental health all throughout the country. So I'm going to start with a personal story, because I want this personal story to inspire you and motivate you to dream just a little bigger in whatever capacity you're working in. I grew up in that small little rural coal mining town, 1 hour south of Pittsburgh, Republic, Pennsylvania. Population about 1,000 people. My dad was a coal miner. We lived in half of a little company house. I bet it was about 990 square feet. We struggled financially, but I was born with rose-colored glasses on, and I still can make lemonade out of lemons any day. That resiliency came in handy for me in January of 1973. I'm going to give you my age now. When I was a teenager, I was 15, home alone with my mother when she sneezed, stroked out, and died right in front of me. You can imagine how traumatic that would be for a teenager. I suffered from terrible post-traumatic stress disorder, depression, and anxiety. After not sleeping, not eating well for about 4 months, my cousin takes me to my healthcare provider and says, please do something to help Bern. That provider did what so many still do, first line in 2023. What do you think that is? Got out the prescription pad, wrote a script for Valium, said give Bern one of these every night, she'll sleep and be just fine. There was no mental health counselor in my little town. There was no evidence-based cognitive behavior therapy, which we know, first-line treatment for depression and anxiety. I remember taking a Valium that night. I slept for the first time in months, but I woke up the next morning groggy, and I said, I don't want to take these anymore. I just got to gut it up and cope. But in the next 4 years, I also lost a cousin that was like a brother to me after a car accident. I lost the only grandparent I ever knew and loved the year after that. And when I was 19, my dad had a massive heart attack. That's a lot of grief for an adolescent. But you know the story. What doesn't break us truly makes us stronger and pulls up within us a resiliency that we never knew we could possibly have. And what I experienced as a teenager made me passionate to become a nurse, then a pediatric nurse practitioner, a psychiatric NP, and go on and get my PhD so I could develop scalable, evidence-based programs to bring help to so many children, teens, and young adults still suffering in this country and not getting any treatment. What's saddest, though, about my mom's story, she had a history of headaches for over a year. And my dad kept saying, please go to the doctor, figure out what's wrong. She went to her family physician 1 week before she died. She was diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. She never took it. But think about this. 60% of Americans have a chronic disease. 6 out of 10 chronic disease. But 80% of chronic disease is totally preventable with just a few healthy lifestyle behaviors that I will end my talk with today. So, how'd I get to Buckeye Nation? Well, I was Dean of the College of Nursing and Health Innovation at Arizona State University. And one day, my assistant comes into my office and says, Bern, there's a leader from Ohio State on the phone who wants to speak with you, but you better not go there. So I picked up the phone, and the chair of the search committee, who was our vice president for research at Ohio State, said, Bern Melnyk, we've seen how you've exploded your college in Phoenix. We want you to come to the Ohio State University and do the same for us. I said, Carol, I'm very humbled that you all thought of me, but I have no intentions of leaving sunny Arizona and moving to Columbus, Ohio. But I had been studying corporate wellness for about 3 years, and I was flummoxed at the fact CEOs of major corporations in this country, they got employee well-being. They were hiring chief wellness officers to care for their population. When I went to search for a chief wellness officer at a university in the country, guess what? There were none to be found. So my dream, because I'm a big dreamer, my dream was to go to a big public university and create the first CWO position in academia in the country. So I pitched that dream. I said, I'm not going to make a lateral move. However, if there were an opportunity to combine the dean's position with a university-wide leadership role as a chief wellness officer, I might be willing to sit down and talk with all of you. She goes back and tells our former president, oh, maybe we could get Melnyk here to Buckeye Nation if you would fulfill her dream and create the first CWO position at a university in the country. The next day, I'm not kidding you, I get a phone call from E. Gordon Gee, our former president. This is exactly how he talks. Melnyk, this is E. Gordon Gee, the current president of the Ohio State University. What the Sam Hill... What the Sam Hill is a chief wellness officer. And what would you do at Ohio State to add value to what we're already doing? Come and talk to me about this dream that you have. That's how I got to Ohio State. It has been a fabulous journey. I have learned so much for the past 12 years. And now I'm in a network of 90 chief wellness officers throughout the country. Here's what I feel a little sad about, though. All of those CWOs, except 3 of us, are physicians. So there's 3 of us that are nurses, and I love my physician colleagues, but seriously, nursing's got to step up into these leadership positions, which are so awesome. So if you haven't seen the provocative paper that I just published in Nursing Outlook on the role of the CWO in improving population health in universities and health systems, a vital gap in the nursing profession, please look up that paper and read it. I predict in the next 10 years, the number of CWOs are going to double in this country because everybody's recognizing now, or at least most people recognize, if our population is not mentally and physically well, we are going to pay for it in a very big way. So I want to give you all a dose of vitamin G today for gratitude. Gratitude is one of the simplest evidence-based practices that we can put into daily practice that'll produce all these great outcomes. So as we move forward, please make it a habit to take and give a dose of vitamin G every day. So I am known for evidence-based practice. I've been pounding the evidence-based practice drum since the late 90s at the University of Rochester. I would like to tell you this is in the DNA of every practicing clinician. But our team's latest studies show evidence-based practice is only implemented by about 40% of our healthcare workforce on a regular basis. So I do a lot of talks and workshops on EBP, but I need to share evidence-based practice plus clinician well-being is the only way we're going to meet the quintuple aim in healthcare. We're not going to do it about unless well-being is attended to, unless wellness cultures are built in all of our colleges, all of our healthcare systems, it's not going to happen, because the terrible twos are still alive and well. Too much stress, too much work, too many tasks, perceptions of too little time for self-care. Back in 2017, and I've had the pleasure of working with your former Dean, Pam Cipriano, on the National Academy of Medicine's Action Collaborative for Clinician Well-being and Resilience. So even before the pandemic, the National Academy of Medicine said, we have a public health epidemic of burnout, depression, and suicide. And we got to do something about this. Our group is still tremendously active and doing so much to enhance the well-being of the healthcare workforce. Last October, we launched the National Plan for Healthcare Workforce Well-being. And as you'll see in this plan, we are really promoting everybody needs to institutionalize well-being as a long-term value. Whether you work in healthcare or whether you teach in a health sciences or nursing college. And we really emphasize creating positive work and learning environments and culture. Culture impacts how people feel and what they do. And culture is something that is not really strategized about as much as it needs to be. Well, then what happened in March 2020, COVID-19 struck. And as CWO for Ohio State, I said to my university-wide wellness team, we got to ramp up everything, because mental health is going to problems are going to skyrocket because of the pandemic. That's what happened all across the United States. And at the same time, people attempted to cope with COVID with unhealthy behaviors. So we saw unhealthy eating go up. We saw alcohol and drug use go up. We saw declines in physical activity. In fact, of the studies that were focused on identifying people who gained weight during the pandemic, the average weight gain of people who gained weight was 29 pounds. So what is that going to mean 3 years from now, 5 years from now? We're going to see even higher rates of preventable chronic disease. Suicide occurred in way too many numbers. And all of you know, because you are fortunate to have Corey Feist here with you, who left and now is CEO of the Dr. Lorna Breen Heroes Foundation. I had the pleasure to have breakfast with Corey and Lily this morning. He is doing amazing work, but it was because his sister-in-law, who was a physician in New York, she was struggling so bad during COVID. She admitted herself for psychiatric care, but she was so scared she was going to lose her license because she was struggling from depression, mental health issues. So shortly after she was released, she killed herself. But so did these other wonderful nurses during the pandemic. Corey's been so instrumental in his foundation in getting the Lorna Breen Healthcare Provider Protection Act passed that has provided multi-millions of dollars to systems to improve the conditions of clinician well-being. For some reason, those of us in healthcare, we do such a great job of caring for everybody else, but we don't take good self-care. Everybody and everything tends to come before taking better self-care. We gotta really recognize self-care is not a nicety. It's a necessity for us to be able to take great care of our families and of our patients. It is a strength to recognize when we need help. It is not a weakness. And we got to make sure everybody we know knows the 988 Suicide and Crisis Prevention Hotline, that you can pick up a phone 24 hours a day, receive confidential help from a professional. So last year, JAMA published a paper with data on how many physician licensing boards throughout the country still ask intrusive mental health questions that are preventing physicians from getting help. So I read that paper and I said to my research team, we got to do this study, this audit on nursing, RN, and APRN license applications. Do you know it took us 8 months to get those applications? It was unbelievable. Don't you think every state board of nursing, when you request to see an application, transparently should be able to give it to you? I cannot tell you what we had to go through. I had to contact deans in certain states of nursing to say, do you know the executive director of your state board? Can you call them to get the application? I had to have one of my PhD students actually start applications and pay for them in those states to be able to access the questions. It was ridiculous, really, and it shouldn't be that way. So I got in touch with Corey, and I said, Corey, he's like, oh, we need to do this. So we finally got almost all the applications, and we used the toolkit that the Breen Foundation has to analyze how many states were still asking inappropriate questions. Our results, 37 states. 37. So we published this, and the good news for Virginia right now is that the Health Sciences Licensing Board that oversees all health science professions have changed now their question. And I think we need to approach it in this way with the other states, so we don't just go after medicine and then nursing and then optometry and then vet med. We need to do it that way. Since our publication, and Corey and I did a national webinar to share these findings with people, 5 states have already changed and pulled these intrusive questions that keep people from getting help. So what else do we know from national studies? The burnout rate. You pick up most studies that study burnout in the healthcare workforce. It's still ranging between 50 and 70%. We know burnout is strongly correlated with anxiety and depression. All of my national studies over the past 5 years have shown the longer the shift work, the poorer the mental health outcomes. We need to stop 12-hour shifts. And everybody gasped when I say that, because they said, but our nurses love 12-hour shifts. But on their off days, they're either going someplace else to work for more money, or they're too burnt out coming off of 3 12-hour shifts. I am banging the drum on this to C-suite folks across the country constantly. I was just in Maine and I was so excited because there's a health system there said, after looking at this evidence, we're stopping 12-hour shifts. But again, paradigm shifts take decades. What year did we say all nurses will have a bachelor's degree? 1965. It's 2023, and we still have about half of our states with only about a 50% baccalaureate. Paradigm shifts take time, but we can't give up. We got to keep banging the drum. This concept of mattering, and you have some experts in your School of Nursing and with CCI. I'm so excited to meet with them because I've been doing national studies too that integrate mattering questions. And in all my prior studies, mattering matters. People who feel they matter to their organization, guess what? Less burnout, less depression, less anxiety and stress. And the other really important construct, perception of wellness culture. So about 5 years ago, we developed and published a valid and reliable wellness culture scale. And we embed that into our annual personal health and well-being survey. So every year I can report out to our leaders of every big unit or college across the university, where are you at with your data? Buckeyes are competitive. They don't like to see we're doing poorer on wellness culture than the other 14 or 15 colleges. But culture in our data constantly shows if people perceive they work in a culture that supports their well-being, they have much better outcomes. And then lastly, this is super sad. Most nurses in all of my national studies, they don't meet evidence-based recommendations for healthy lifestyle behaviors. Only about 20 to 25% of nurses actually get the recommended 150 minutes in of physical activity a week. Nurses average just 2 fruits and vegetables per day. The majority do not sleep at least 7 hours a night. And alcohol misuse has risen in our profession like wildfire. especially among women. So we got a lot of opportunity in front of us. Now, we just did 2 studies. One we've already published, the other one's ready to go in. We looked at the health and well-being of chief nurses and nurse managers. And here's what we found. Nurse managers both had high rates of burnout, but burnout was higher in the nurse managers. Clinical anxiety, 30% of nurse managers met the cutoff for clinical anxiety. 15% met the cutoff for depression. So depression and anxiety was higher in this layer of nurse managers. We really got to give more attention to that group of people because they're under tremendous strain. So what we found, though, in these studies, we've been seeing in all my other studies. I've done studies with optometrists and pharmacists to compare. How does everybody compare with each other? But again, my data shows burnout, depression, and anxiety strongly correlated with, do I matter in this organization? Strongly correlated with, does my organization have a culture of well-being that supports me to be healthier? We also did a study with doctorally prepared nursing faculty throughout the country. What we found in these 224 doctorally prepared faculty, pretty equally split between PhDs and DNPs. About a third were burnt out, a third. Now, if our faculty, if 1 out of 3 are burnt out, what kind of adverse impact are they going to have on our students? And if our faculty aren't walking the talk with wellness, students, we're going to grow up another generation of students who have the same poor outcomes that we currently have, or students who aren't equipped to face the character builders that they face when they enter the work environment, so that 35 to 60% leave in the first 2 years after they graduate. What was really interesting in our study is PhD prepared faculty were more depressed than DNP prepared faculty. Now, we collected a ton of open-ended responses, and we figured that finding out very easily. The PhDs felt under tremendous pressure for grant writing, funding, and scholarship. But still, even if DNPs weren't as depressed, 10% of DNPs, 17% of PhD faculty, that's a lot of depression. And we need to get help for those people. Well, a group of us in the Big Ten schools also did a study with health sciences faculty. So this included nursing faculty, medical school faculty, veterinary medical faculty. During the latter part of the pandemic, we found almost 50% of the faculty struggled with burnout. 53% of these faculty said, our college is not at all supportive, or only somewhat supportive of our personal wellness. But again, the two big constructs that predicted burnout, depression, anxiety, mattering, whether they felt they mattered, and culture, whether they perceived they worked in a supportive wellness culture. During the pandemic, one of my terrific faculty, Kate Golick, walks in my office one day and says, "Bern, I am so burnt out as a parent. I have 4 little children. You know, I'm juggling my faculty NP role, juggling 4 children. We need to do something about parent burnout." And I said, "Kate, what do you want to do?" She said, "Help me, because I'm a DNP. You're a PhD. You have the research methodology skills that I don't have. Help me develop a scale to measure parent burnout." I said, "Kate, there's already a couple that exist in the literature. I know of those." But I said, "Kate, do any exist to tap working parent burnout?" We went and we looked. There was not one to be found. So I said, that's the one we got to develop. So we developed content, construct validity, Chromebook alpha reliability. We surveyed almost 1,200 parents, established this as a valid and reliable scale, went to talk with my senior director of marketing and communication, and I said, "This is a hot topic, this working parent burnout. Phil, can you call Good Morning America or the Today Show and see if they'd be interested?" Because what we found was 2/3 of parents were burnt out from this survey. Today Show gets a hold of him right away and said, "Don't give this story to anybody else. We want it. We're going to send a camera crew to Ohio State to work with Bern and Kate because we want to do a feature on this on the Today Show." Their camera crew came and filmed us. I am not kidding you, for 6 hours, and we got a 6-minute spot on the Today Show. But what was really cool about that is they put up our instrument on their website and our report that gave evidence-based tips about how to handle working parent burnout. We had tens of thousands of people who completed that. They said that was one of their biggest stories that year.
It's a daily struggle.
So anyway, when you think about dissemination, it's really important to think just beyond publication. It's important to think of the media. My biggest pet peeve is when I walk through airports and pick up lay journals like Oprah and Prevention and Parents. We're hardly ever quoted as nurses. So again, we've got to think beyond. Scholarly publication is important, but our work needs to get out there to the lay public. It's really important. Now, we have so much data to show clinician burnout costs the U.S. healthcare system billions of dollars every single year. It affects clinicians. It affects learners, our healthcare systems. It lowers the quality and safety of care. Think about this fact. Preventable medical errors are the 3rd leading cause of death in this country, behind cardiovascular disease and cancer. 250 to 400,000 people lose their lives every year from preventable medical errors, many that are made by well-meaning clinicians who are simply just burnt out. This is such a big public health problem. And then we're living through the great resignation. 1 in 5 physicians and 2 to 5 nurses said they intend to leave their practice altogether in the next 24 months. Wellness cannot be optional. I tell deans this all the time. You offer things as an elective. Students aren't going to take them because they're inundated with just their core coursework. At Ohio State, many of our colleges now are requiring evidence-based programming that we know works, that drops burnout, that drops depression, that drops anxiety. 2/3 of college students who are no longer in college aren't there because of a mental health issue. So we can't keep saying, oh, let's do this. We'll provide it as an elective. No, it's a necessity. And several studies show return on investment is good. Value of investment is good if you invest in well-being. At Ohio State, every 2 years, we calculate ROI and VOI. For the last several years, our ROI, so just the financial side of things, has ranged. For every dollar we invest in wellness, there's a return of $2 to $3.65. Our administrators can't argue with me when I take them those numbers and say, I need more money next year. And look how much money I'm bringing in. I pay for my own people, and then I bring you a big gift of this many more million because we save money, because our people are healthier. This was a systematic review that came out this year. They looked, here's the problem with ROI. Not everybody measures it the same way. So it's hard to do a meta-analysis where you can pull all this data together. But in this systematic review, and you see how many variety of interventions were studied. But 56% found a positive ROI with these particular interventions. But I will tell you, randomized controlled trials, we need so many more of those, and we need people to start figuring out their ROI using the same methodology so we can really compare across. And Linda Aiken, who is famous in the field for her healthcare work, they did a study. They surveyed over 21,000 physicians and nurses at 60 nationally distributed U.S. magnet hospitals. What they found, a third of the physicians and half of the nurses reported were burnt out. But here's what's really important. These clinicians said, don't talk to us anymore about building our own resiliency. Now, that is important, and we cannot ignore that. But There are system issues that cause burnout, and those system issues must be fixed. Because if they're not, like at Ohio State, we have so many evidence-based wellness programs that we offer to our faculty, staff, students within a culture of wellness. But if we still have system issues, like if it still takes 15 clicks in the electronic health record to give a flu shot, that's a problem, right? So unless we fix those system issues, along with building a culture, along with building resiliency, you're not going to move the needle that much. And what I have learned firsthand over the past 12 years in spearheading health and well-being for Ohio State, you're not going to move the needle unless you focus on these three things. Building a culture, a wellness culture. Focusing on system fixes, and then offering evidence-based interventions to people across your organization. Now, since 2000, I have always quoted the study by Bayliss and Bourne. It takes 17 years to translate findings from research into clinical practice to improve care and outcomes. Well, in 2021, I don't know if you saw this study, but Kahn and colleagues said, wait a minute. Guess what? We've moved the needle 2 years in the past 2 decades. And it only takes 15 years now to translate findings from research into clinical practice to improve care. At that rate, it's only going to take us 150 more years between the production of research evidence and its quick implementation in clinical practice to improve care and outcomes. We know what interventions work. So as part of the NAM initiative, I pulled together a team of people and said, let's do a systematic review and let's find out for nurses and physicians what interventions lead to less burnout, less mental health issues, more healthy lifestyle behaviors. These 6 things work. So every college, every healthcare system across the United States should simply implement these interventions in addition to building a culture of well-being and fixing system issues. What have we learned through all the literature? This is really important to succeed in this area. Senior leaders have to commit, and they've got to invest. This is not an expense. It is an investment that has good ROI and VOI. They've got to understand that. You need somebody, whether they're called a CWO, a director of wellness, whatever they're called, you need a leader positioned high up at the entity to spearhead this, to pull everybody together, to create an exciting vision, mission, strategic plan. And then you have to take an evidence-based quality improvement approach. And this is where most institutions fall down. They don't measure data annually, regularly, and then go beyond that. You don't just measure data to measure data. You got to have your data guide strategy. So what are you going to do next year? But this culture, again, is so critical. Most universities, wellness is run out of HR, and wellness from students is run out of student life. It's really tough to build a culture of well-being where everybody's doing their thing in silos, but there's no leader and no structure that runs across the university and health system to really get this going. So I'm going to finish from sharing snippets of what we've done at Ohio State. We're a monster-size institution. We have 7 hospitals. My charge, Bern, get everybody healthier. That's your charge, Build this great wellness culture and get everybody healthier. Well, it all starts with a vision and a dream. You got to know where you're going, or else you're going to end up someplace else. And you got to be able to energize and get a team really excited about where they're going. And we are super serious about our vision. We're in our third 5-year strategic planning effort right now. It should be done in the next month or 2, and then it's got to go through all the approval channels. But you can download, so I've got a CWO website, and the strategic plan is right up there, and you can download it there. We've got a huge wellness team across the university. All these units are part of our wellness team. I created what I call a One University Health and Wellness Council. Leaders from all those entities, we sit together once a month. We review our data. We plan strategy based on the data. We're constantly perusing the evidence to say, what am I missing? What else can we do? We use the socio-ecological framework and life course perspective as our guiding framework and strategy. We target evidence-based interventions to the individuals, to the family, social networks, workplace culture and environment, policy. And then we measure outcomes diligently. This is the magic for doing it. It's right here. You got to target top leadership down to grassroots and get to the middle people. Those managers are really super key. Got to build a great culture, and you got to religiously measure outcomes and use that data to guide further strategy. We have learned from our data, the more engagement in our programs, the better health and well-being outcomes people have. We track our data. We've got a scorecard. So year by year by year, I show trends. I can show you exactly what's happening. I make 42 presentations every spring to the VPs and deans of all of our colleges and units, giving them their de-identified aggregate data for their population. So I could tell you exactly who at Ohio State has the highest burnout rate, what unit, who at Ohio State is doing the best on physical activity. So again, if you look at the evidence, it's all of these things that are important. You've got to take a comprehensive, multi-component approach for this to be really successful at your institutions. But I'm telling you, mattering and culture, they are such potent variables that predict so much. We've got to engage our clinicians. We got to tell them, you matter. So last year I had a vitamin G campaign at the university. Take and give a dose every day. This year I'm putting out a You Matter campaign. So we're adding that piece to everything we do. I just have started a CWO podcast, micro learning modules that are available to our faculty, staff, and students on a variety of topics. But we got to get rid of bureaucracy and stupid stuff. Seriously, think about everything we do that isn't really necessary. Are you kidding me? We can get rid of that. You know, last year I sent out an email to faculty. I want to know again, what stupid stuff are we still doing? What do you think if we eliminated it, you could have more time to do what brings you joy? We have a program. Several universities have what's called wellness ambassador programs. I don't like the term ambassador. I like innovator because I want to empower my people to innovate for impact. So we have a formal Buckeye Wellness Program innovator initiative, and we have 700 faculty and staff who volunteer about 3 to 4 hours a month to work with me and my wellness team. A lot of places don't have structured programs. If they have one of these programs, ours is structured. We have programming. I give out grants to these people to do innovative, wonderful wellness stuff in their units. You'd think I'd give them the best Christmas gift in the whole wide world, but they're awesome. We have Buckeye Paws. I know the college has a dog, a pet therapy dog. We have 32. So I go around the university and the medical center. I take Shiloh or one of the other dogs with me, and the stress just melts off of students as well as faculty, staff, and clinicians. So I'm going to end my talk by saying we need a paradigm shift in this country so bad. We will always need fabulous sick and crisis care. Always. But unless we shift our paradigm to one of more wellness and prevention, do you know our country only invests 3% of its healthcare spending in wellness and prevention? That's it. That's it. And we wonder why we're the lowest on the totem pole, right? Among Western world countries. So I'm going to just finish with a few good tips for each and every one of you. You can't keep pouring from an empty cup. You have got to say to yourself, you got to face your true story. If your story is one that you give to everybody else and yourself comes last. Now, during the pandemic, I came home one day and my husband asked me a simple little question, and I nearly bit his head off. And I'm not that way. I mean, people who know me know. You will hardly ever see me irritable or angry. It's just not my nature. But after I reamed John out for a simple question, he looked at me and said, "Bern, you're burning out. You better face your true story like you tell other people. What are you going to do about this?" And I thought for a couple of minutes, and then I said, "John, I know what we're going to do. We're going to take a bucket list trip." He said, "Okay, we have several yet on our list. Which one do you want to take?" I said, "I want to go to Tanzania and watch the wildebeest migration." He said, "During the COVID-19 pandemic," I said, "Yes, I got to go." We went. Here are pictures that we took. It's an amazing experience. But you know what I told my teams? I said, I'm not accessible at all. For 10 days, I'm not going to open my computer. I'm not going to look at email. You are fully capable of handling whatever happens. I have got to get a mental break. And seriously, that was the best thing I could have ever done. And I will never let myself go there again. But if you think about it, cardiovascular disease is still technically our number one killer, but truly, it's our behaviors that are our number one killer. And I'm not kidding you when I say beware of your chair. Evidence shows if we sit even 3 hours a day, that increases our cardiac risk by 30%. If we sit 5 hours a day, that's comparable to smoking 1.25 packs of cigarettes a day. Now, some of you look totally shocked. How come we all didn't stand up? It's culture. It gets back to culture. So this is all you got to do. This is it. You want the recipe for how to prevent 80% of chronic disease. This is it. But everybody says, I couldn't possibly do 150 minutes of physical activity a week. I say, yes, you can, especially if you decrease the length of your meetings. Like, why do we need 60-minute meetings? They can be 45. I've done that. I don't do 60 minutes anymore. I get in 10 to 15 minutes of recovery breaks several times a day. And you want to do something even better? Decrease your number of meetings. Recent evidence shows a decrease in meetings by 40% leads to an increase in productivity by 70%. Then everybody gets happy when I talk about alcohol. If you don't drink alcohol, don't start. But if you do, limit it to one standard drink a day. Then everybody asks me, Bern, how big can that drink be? And I say, not the size of the alcoholic beverages we get in Vegas. But take a look at this slide. You see something funny about it. It's a real fitness facility in the state of California. They have a choice. You can either walk the stairs or take the escalator to go work out at the gym. Well, 2 psychologists, one did a study. How many people during the course of a day, during a week, would choose the steps? You know what they found? 2 people a day. That's it. So when we're faced with choices, let's make the healthier one. And my charge before you leave here today, if you didn't set a New Year's resolution, today could be your January 1. Take one of those behaviors that I just showed you and say to yourself, if you're only doing 15 minutes of physical activity, say 3 days a week, say I'm going to go to 20. Don't say I'm going to 30 minutes, because you're going to fall off the wagon. Inch by inch, it's a cinch. Yard by yard, it's hard. It takes 30 to 66 days to make or break a new habit. We all have the same amount of time. It's what we do with it that matters most. I'm going to show you this clip.
These are roughly 28,835 jelly beans. I counted out 500 of them and used those to weigh the rest. In this pile, there's 1 jelly bean for each day that the average American will live. You might have more beans in your life, or maybe less, but on average, this is the time we have. Here's a single bean. It's your very first day. A special day, but kind of a rough day on everyone involved. Add 364 more and you have the first year of your life. Now, for a sense of scale, here are your first 15 years, 5,475 days, which brings us to the threshold of adulthood. And at that moment, this is the time that we have left. And this is, on average, what we will do with all that time. We will be asleep for a total of 8,477 days. If we're lucky, some of that time we'll be sleeping next to someone we love. We will be in the process of eating, drinking, or preparing food for 1,635 days. We'll be at work, hopefully doing something satisfying for the equivalent of 3,202 of those days. 1,099 days will be spent commuting or traveling from one place to another, maybe a little bit more if you live in LA. On average, we will watch television in one form or another for a total of 2,676 days. Household activities, like chores and tending to our pets and shopping, will take another 1,576 days. And we will care for the needs and well-being of others, our friends and family, for 564 days. We'll spend 671 days bathing, grooming, and doing all other bathroom-related activities, and another 720 days will go to community activities like religious and civic duties, charities, and taking classes. After we remove all those beans, this is what remains. This is the time that we have left. Time for laughing, swimming, making art, going on hikes, text messages, reading, checking Facebook, playing softball, maybe even teaching yourself how to play the guitar. So what are you going to do with this time? How much of it do you think you've already used up? If you only had half of it, what would you do differently? What about half of that? How much time have you already spent worrying instead of doing something that you love? What if you just had one more day? What are you going to do today?
That's powerful. You know what's sad? Most people don't change unless crisis happens or their emotions are raised. So I constantly use story. I always say evidence plus emotion gets people to change. And I'm going to finish by saying, what are you going to do in the next 5 years if you know you can't fail? You see, it gets back to the dream and purpose and our passion. If we are aligned with our dreams, our purpose, and our passions, it's going to buy us 7 additional years of our life. We're going to get up on a Monday morning and jump out of bed and say, I'm so excited to go to work today. When we're not aligned, our energy just drags. So, if you don't leave here today, make the commitment to do a little better self-care for you personally. Do it for the people who love you, who want you to be around for a really long time. I didn't have my mom to see me graduate from high school, become a nurse, go on to have this beautiful family. Yes, there are days I get up, I don't feel like taking my 3 character-building dogs for a mile walk, to get my 15 minutes of physical activity in first thing in the morning. But then I put these beautiful faces, my 3 beautiful daughters in front of me, my little grandsons, and I say, you know what? I'm doing it for them because I want to continue to be around, to influence their lives as they grow up. So I'm going to give you a challenge. I want everybody to do my 155 eye-opener challenge. So every morning you are worth 11 minutes. You get up, 1 minute of vitamin G. Think about who you're grateful for, what you're grateful for. 5 minutes reading in a positive book or listening to a positive podcast, because we get bombarded with so much negative during the day. And then 5 minutes of physical activity. You can do it. 30 to 66 days, it'll be a habit for the rest of your life. And you will watch your mood improve significantly. And if I could not motivate you enough, this little girl can, to finish my talk.
Do it! Just do it! Don't let your dreams be dreams. Yesterday you said tomorrow. So just do it! Make your dreams come true. Just do it! simple. You should get to a point where anyone else will quit. And you're not going to stop there. No, what are you waiting for? Just do it. Just do it. Yes, you can. Just do it.
Thanks, everybody. I just noticed I told more stories. I never know. Am I going to do that? Am I not? It's whatever is in my heart that day. But I can answer a couple quick questions before I have to go for my flight. So, questions that any of you might have. Yeah.
Could describe what a culture of wellness would look like? Like, how will we know it when we see it?
Yes. I will share my tool with all of you. It is 10 items. It is such things like our leaders walk the talk. Our direct supervisor supports us in our wellness activities. There's 10 items there, Natalie. So if you look at that scale, it'll give you the roadmap for sure. Other questions? Yes.
Yeah, I'm a mental health provider, and I'm always getting these questions about ROI for mental health.
Yeah.
And sometimes it's hard to quantify that
Yeah.
and break it down.
Yeah.
It sounds like that's something you've been doing.
Yeah.
And I'm very inspired by what you've done. Could you repeat something you said? For every dollar
Yes.
you spend, you can do DOI.
Okay, so for at least at Ohio State, because there are very few of us that measure, put a dollar amount to what we do, and I've published that. So if you go to that recent publication I did on the role of the Chief Wellness Officer, it'll be in print there. But for every dollar we invest at Ohio State, we get back between $2 and $3.65. That's our return. So it pays for what we're doing and then beyond, gives the university money.
Thank you.
Yeah. Any last questions? Yes.
Have you done any work with either ACEs or PACEs in any of your literature that you've done? Well, they used to call them adverse child.
Yeah, adverse child. And they are so prevalent. We've talked about including questions related to that in our personal annual wellness assessment. We have not done that yet, but we're talking about that now. Yeah. Yes.
Could you give a few examples of some of the stupid stuff that you got rid of?
Some of the stupid stuff that we got rid of. Certain meetings. In fact, on Mondays, I said, besides getting rid of a few that we didn't need, I said, let's not have any meetings before 11 a.m. on Mondays. Because think about it. What do people do on Sunday night? A lot of people, a lot of faculty, they're on their email trying to catch up. And I did no meetings whatsoever on Fridays, because that way people could really focus. And I had a faculty respond to me after I put the announcement out, we're not going to meet anymore during these times. And she said, just one, please, on Fridays, because that's what we've done. No meetings on Fridays. You got to either cut down your frequency, do them on a different day, but Fridays are going to be sacred. That so helped people. That in itself. We got rid of some other processes for the whole promotion thing. You've got to adhere to what the university has to have you do, but then you got to look at specifically, what are we doing here that isn't really necessary? Yeah. It's a good survey question for people. Anything else? If not, keep dreaming, discovering, and delivering. Take good care.